Good morning, everyone. Let's wait for a few more people to join. We are already 15 minutes late. We will wait for just 5 minutes and start. As we have promised, that we will straightforwardly go to Kent's 12 observation and its application in our daily practice. We are at the finish of our series of lectures. At the end of our series of lectures, we will discuss some points in philosophy, and some aphorisms are remaining which are more important from a viewpoint of academic. So we will discuss those also. Each and every aphorism will be discussed. Okay. I hope I am audible. Am I audible? Okay, thank you. So Kent's 12 observation. Okay, let it be. Chapter's name is Prognosis After Observing the Action of the Remedy. Chapter number 35. What is Kent's 12 observation? It is nothing but the observation after giving medicine by Kent. And one thing should be clear in your mind, that it is in centesimal potency. Okay? It is not related with the LM potency, 50 millisimal potency. That too, a single dose. Okay? So Kent was a 4th edition prescriber. Okay, wait and watch, not 5th edition. We have studied about 5th edition, changes in the 5th edition. Okay, regarding repetition and repetition, how repetition was allowed by Hahnemann in 5th edition, and even the frequent repetition of medicines like sulfur and mercurius were given. So this repetition was not there in Kent's practice. Kent was a 4th edition prescriber, single dose, wait and watch method. So how many observations are there? Altogether, Kent has compiled 12 observation, which is famously known as Kent's 12 observation, though there is this is wrong to say that Kent has observed this, and it is an contribution of Kent. The contribution of Kent is that only he has compiled the several observations previously observed by many scattered physicians in the history of medicine, right from started from the Hippocrates to Hahnemann. Okay, what Kent have done? Kent have made the thing easy for the students like us to grasp the subject, which has been scattered throughout the history of medicine, throughout the literature which has been scattered. Kent has compiled those observations. Okay, so it is wrong to say this is Kent's 12 observation. Rather, the 12 observation, which there may be many other observation of physician which has not been compiled here by Kent. Kent have chosen only 12 observation, that is we are using in our clinic also, with some sort of fallacy, because we are usually not where Kent's 12 observation is applicable, where there is the prescription was based on only the 4th edition of Organon. Okay, so Kent observation was valid, mainly purely valid with those. Okay, so we are using in our clinic with some sort of fallacy, because no one is now giving one single dose and waiting and watching. At least people are giving at least 2 or 3 doses. Okay, or like repetition in the 5th edition, or like 50 millisiemal potency. 50 millisiemal, no question of Kent's observations. In 50 millisiemal, no question of Kent's observation. But in 5th edition, to some extent, you can think that these are observable. So Kent's observation in daily practice is day by day becoming obsolete because of this increased number of practitioners who are using 5th edition repetition method or 6th edition rather than the Kent's 4th edition prescribing, that is wait and watch with a single dose. Okay, the number of prescribers with wait and watch with a single dose is declining day by day. That has its own merit or demerit. We may discuss that point at some point of time in future classes. So these 12 observations are is for a prognosis, a tool for prognosis. Like the picture I have shared today in the WhatsApp group, today morning in the WhatsApp group, like nitric acid was given in repetition, okay, for 1 week, 1 dose of nitric acid to be taken daily in the morning. Okay, after 1 week, patient came with these crack on the corners of mouth and long fissured on the tongue. Okay, so this is what? This is 9th observation of the Kent's 12th observation. The proving, when the patient starts proving, this is the observation. And what I have done, I have prescribed basing on the 5th edition, repeated the dose frequently, and to some extent in the 5th edition, Kent's 12th observation is observable. So this was the case where this proving symptoms started coming. What is the benefit of this? I have gained more confidence over these 2 symptoms, that a longitudinal crack on the longitudinal fissure on the tongue and the crack on the corner of mouth. These are the 2 symptoms. I asked few more symptoms if it was there, if it is the urine become offensive or not, if the stool become loose or not, but these symptoms were not there. Maybe they will come after repetition of 4th and 5th, maybe 2nd or 3rd week. Okay, so these things we have discussed also during we were studying proving. When we were studying proving, these things we have discussed, that what is the advantage of single dose proving and what is the advantage of multiple dose proving or large dose proving. Okay, so this is one of the example of proving in multiple dose, where one of the characteristic symptoms of nitric acid was observed by me, and now I am more sure of more confident of this symptom. The cracks on the corner of mouth, we have read it and now we have seen it. Now one thing you will also gain confidence after this, that this has produced a crack on the corner of mouth. Now you have given a patient with the same kind of lesion and that has been cured. That will boost your confidence with nitric acid and that symptom. Okay, so that is Kent's 9th observation. What are altogether the 12th observation is very important for your university examination. Rather, it is not important for your clinic, not that important for your clinic purpose, but it is important for your university examination. Okay, so Kent's 12th observation can be summed up with aggravations. How many aggravations are there? Observation number 1, 2, 3. Okay. Now there is no aggravation but amelioration. Aphorism, observation number 4. Okay. Amelioration 5, 6, 7. These are amelioration. Now proving 8 and 9. Okay. Again, what else remaining? 10, 11 and 12. So this can be remember for your university examiner with a simple mnemonic now. NOW. That is new symptoms coming, old symptoms, and symptoms took the wrong direction. So a quick recap on again. Aggravation. First three, 1, 2, 3 are aggravation. Fourth is no aggravation but amelioration. That is why it is being represented with the sign of is equal to. Next is amelioration. 5, 6, 7 is amelioration. Proving is 8 and 9, and NOW now is 10, 11, 12. New symptoms, old symptoms, and wrong direction. Okay, so this is a quick recap, summary of 12 observation. Clear? So now we will go to text. As our mode of study is follow the text and describe the difficult points with examples. So chapter number 35, prognosis after observing the action of the remedy. After a prescription has been made, the physician commences to make observation. The whole future of the patient may depend upon the conclusion that the physician arrives at from these observations. For his action depends very much upon his observation. This should be underlined. His actions, why second prescription is important, why 12 observation is important, why observation is important, because his observation will decide his future course of action. Okay, and upon this action depend the good of the patient. If he is not conversant with the import of what he sees, he will undertake to do wrong things. He will make wrong prescription. He will change his medicine and do things to detriment of the patient. There is absolute but one way, and nothing can. The place of intelligence. If you talk with a great many physician concerning the observation you have made after giving the remedy, you will find that the majority of them have only whims or notions on this subject and see nothing after prescription is made. These observations I am going to give you have grown out of much watchfulness, long waiting and watching. Underline this. In the homeopathic physician, that not necessarily by Kent, okay? That not necessarily by Kent, rather by previous physicians who have given these observations and Kent have compiled. Okay. Similarly, Kent's repertory has also contribution of Dr. Lee. Okay, that has not been mentioned anywhere, I think. If the homeopathic physician is not an accurate observer, his observations will be indefinite, and if observations are indefinite, his prescription is indefinite. Okay. It is taken for granted after prescription has been made and it is an accurate prescription that is acted. Now if a medicine is acting, commences immediately to affect changes in the patient, and these changes are shown by signs and symptoms. Underline this, these changes are being shown by signs and symptoms. And what are those two common reaction of the remedy? Two common reaction of the remedy are either it will aggravate or it will ameliorate. Okay. Either it will aggravate or it will ameliorate. Chapter number 16, Robert's remedy reaction, page number 124. Chapter number 16, page number 124. Among the most common reactions after the remedy has been administered is aggravation or amelioration. This may be an MCQ in your examination. This has been an MCQ previously. What are the two most common reaction of the medicine? Okay. Now, come to this. There is always an index that tells him what not to do. Acha, the inner nature of the disease appears to the physician through the symptoms, and it is like watching the hands upon the clock. This watching, this means you see that watch is you are just watching the hands of the clock. You are not knowing, you are unobservant of what is going behind this. Okay, there is a machinery which is working behind to move these hands. Okay, that is what Kent is saying, that you are watching the symptoms. You are watching the symptoms. What is going inside, it is just revealing to you through the symptoms. That has been discussed many a times before while we were discussing aphorism number 6 and the vital force. So the inner nature of the disease appears to the physician through the symptoms, and it is like watching the hand upon the clock. This watching and waiting and observing has to be done by the physician in order that he may judge by change what to do and what not to do. It is true that homeopath is not long in doubt in many instances what not to do. There is always an index that tells him what not to do. If he is a sharp, vigilant observer, he will see the index for every case. Okay, this need a little clarification here. This needs a little clarification here. Okay. Wait, there is, I will be come back. Okay, sorry for interruption. So one thing should be made clear here, that these index may be the pathological reports also. Okay, these signs and symptoms includes pathological reports. Nowadays previously we were unable to see what is going inside. Okay, that is why we were not giving much value as a homeopath maybe a century back. But now we are with the most sophisticated instruments. We can even see the gastric ulcers. We can see what is going, to some extent, what is the pathology behind, like a pain in the right lumbar region. A pain in the right lumbar region will be differentiated from a pain in left lumbar region, pain in right hypochondria, pain in left hypochondria. Okay, and you can precisely will be able to diagnose the reason behind this pain. Okay, like the pain is, and don't confuse with that I'm asking you to prescribe on the pathology. Okay, the thing will be clear. We have discussed this while discussing aphorism number, I think, the surgical disease, when we were discussing that this symptom pain here in the right hypochondria, these symptoms may be due to liver enlargement. Okay, now the pathological report is saying that right lobe of the liver is enlarged. Okay, the pathological report is saying that right lobe of liver is enlarged, or the pathological reports is saying that fatty liver, or the pathological report is saying that left lower lobe of the liver is enlarged, or maybe the whole liver, there is a hepatomegaly, mild hepatomegaly. Okay, the remedies will differ. Okay, you know that right lobe of the liver or caudate lobe of the liver will be more affected, will be more cardiacs have more affection to the right lobe of the liver. Chelidonium has more affection to whole liver. Okay, if there is an involvement of gallbladder, if there is a involvement of hepatobiliary tree, if there is an involvement of other parenchyma of the liver, okay, what are the pathologies, and you will able to differentiate your remedy. You will be able to individualize your remedy more accurately with the help of pathological report. Okay, I'm not saying to you to prescribe on those reports, but it will not be wise to prescribe on the symptoms only. If you are able to see the pathology behind this symptom and your remedy is covering both symptom and pathology, then it is well chosen remedy. Okay, but if your remedy is covering only the symptoms, it has no affection, it has no role with that pathology, that means you are covering only the secondary symptoms. You are covering only the secondary symptoms of the patient. Okay, like the breathlessness due to ascites. Okay, and you are giving your aspidospharma, you are giving your yabasanta, you are giving your all the lungs remedy, but you are not seeing the pathology behind that symptom. If you are giving a medicine which is covering your symptoms of breathlessness, plus it has a role to play in ascites also, that will be the well chosen remedy. Okay, so I have many a time I have given example of ML Tyler chapter Cyanothus, where he has given she has given example of Barnett, where Barnett is saying that a loss of appetite, nausea, vomiting, if it is due to enlarged spleen, and if you are giving the covering only the symptom, and that medicine has no way to affect the spleen, that is not well chosen. You have to choose a remedy which has a pathology, because it is a secondary symptom due to that pathology. You have to choose a remedy which has got action on the affected organ. Okay, clear? So these pathological reports are also your index, your guide in your prescription. Okay, like most common test we are doing nowadays is CRP. What CRP indicates? Any sort of inflammation in the body. Now you have given your medicine, that patient is improving, and CRP report is coming less and less. This indicates that patient is improving. Besides signs and symptoms, this also indicates the patient is improving. Clear? Now this IgE level is very high. This allergic rhinitis cases or angioneuritic edema cases of angioneuritic edema, where IgE level is very high, and that will be your index of your patient's improvement, because these patients are very of low vitality, profoundly affected with psychosis. They won't be able to give you perfect, means accurate descriptions of their disease, whether it is decreasing or increasing. So you can rely here on the reports. Okay, if you are treating a coma patient in a comatose patient, how you will decide? You will rely on this pathological report. You are treating a patient of CRF. Okay, you will be relying on renal function test. Okay, plus those signs and symptoms, the urine, the water intake, the urine output, the edema, okay, and other signs and symptoms, plus urea and creatinine. That will decide your course of action. So this will be included in the index. Okay, there is always an index that tells him what not to do. If he is sharp and vigilant observer, he will see that index. He will see the index of for every case. Of course, if a prescription is not related to the case, if it is prescription that effect no change, it doesn't take long to see what to do. Such waiting for a foolish prescription is but loss of time. and that should be taken into account among observations. The observation taken after a specific remedy has been given sufficiently related to the case to cause changes in the symptoms are those of value. The changes are beginning. What are they like? What do they mean? To what do they amount? The physician must know when he listens to reports of the patient what is going on. The remedy is known to act by changing of the symptom, the disappearance of symptom, the increase of symptom. Okay, changing of symptom. This is remedy reaction. Remedy reaction. Changing of symptom, disappearance of symptom, increase of symptoms. That includes both signs and symptoms, and that pathological reports, you can say. The amelioration of the symptom, the order of the symptoms are all changes from the remedy, and these changes are to be studied. Okay, underline this. Among the commonest thing, same what we have read in Roberts, same also here. Among the commonest thing that remedies do is to aggravate or ameliorate. To aggravate or ameliorate, underline this. The aggravation is of two kinds. The aggravation is of two kinds, underline this. We may have an aggravation, the aggravation of disease, underline this. Aggravation of disease, patient is growing worse. Or we have an aggravation of the symptom in which the patient is growing better. Underline this. Aggravation of the symptoms. And you can mark in the bracket, give the parenthesis, the aggravation of original symptom. The patient, aggravation of original symptoms the patient comes with. Okay, so two type of aggravation has been discussed here, and the third type you can add, that is medicinal aggravation. Disease aggravation, aggravation of the symptom, by that we mean homeopathic aggravation, and the aggravation of medicine. We have discussed this many a times before. What is disease aggravation? Disease aggravation meaning by the symptoms are coming from the arena of disease, like the case of prostate cancer where the backache was seen. Okay, and you know by your knowledge of clinical medicine that this backache is due to metastasis of the malignant cell of prostate to the vertebrae. Okay, so this is nothing but the progression of disease. Or you have given your patient remedies for cough, and patient came with the breathlessness, hemoptysis, fever. All these are indicative of aggravation of disease, or that the progression of disease. And this you know from your knowledge of clinical medicine. This is coming from the arena of disease. Okay, now the new symptoms coming from the, like nitric acid case I have shared today in WhatsApp group. That nitric acid is that symptom, that corner, crack on the corner of the mouth is a symptom of nitric acid coming from the arena of medicine. That is what? Medicinal aggravation. Okay, that is medicinal aggravation. And the third type of aggravation was the homeopathic aggravation, where the increase of original symptoms, no addition of new symptoms, no old symptoms. Okay, new symptoms, you have to differentiate between the symptoms coming from the arena of disease and the symptoms coming from the medicine. Okay, so this new symptom, no new symptoms have been added, rather the original symptoms have been increased. And this is what you will see, where you will see the amelioration, a general sense of amelioration with the patient with the aggravation of the original complaint, and that is what we call homeopathic aggravation. Okay, an aggravation of the disease means the patient is growing weaker, the symptoms are growing stronger. But the homeopathic aggravation, which is the aggravation of the symptoms of the patient while the patient is growing better, is something that a physician observes after a true homeopathic prescription. The true homeopathic aggravation, I say, is when the symptoms are worse, but the patient says, I feel better. Okay. When the symptoms, and add in the bracket there original symptoms of the patient. Okay. We must now go into particular concerning these states as to time and place, as how the aggravation occurs, as how to the amelioration occurs, as to duration. The aggravation, amelioration, the directions of the symptoms, and many other things have to come up and be observed, and judgment has to be passed upon them. First of all, the patient should be the aim of his on the patient to determine whether he is improving or declining. We have to judge the symptoms to know that this is taking place. Very often the patient will say, I am growing weaker, and yet you have know that what he says is not true. So certainly can you rely upon the symptoms and their story, which is more faithful than the patient's opinion. Many times the patient will say, doctor, I'm so much worse, and yet you examine into symptoms and you find that he's really doing very well. Just the moment that he finds out that you are encouraged, he feels better and roses up and wants to eat. By symptoms also you can tell when the patient is really weaker, and if the symptoms are taking inward or rather than an outward direction, you will know, even if he is encouraged, that there is no encouragement for him. We have the symptoms that which we can rely. The knee pain is better, but there is a heart pain. Time and again he feels heaviness here, but the knee pain, doctor, the knee pain is good and knee pain is better. The symptoms is taking here the wrong direction, and you should be alarmed with your medicine. In the old school, we have nothing but the information of the patient. This is of little account. After making a homeopathic prescription, the symptoms themselves must be corroborated. The patient's opinion must be corroborated by the symptoms. The symptoms corroborate what the patient says in many instances, but the symptoms are physician's most satisfactory evidence. Okay, another general remark we need to make, namely that we should know by the symptoms if the changes occurring are sufficiently interior. If the changes that are occurring are exterior, the physician must be acquainted with the meaning of them, so that he will know by that whether the disease is being healed from innermost, or whether the symptoms have merely changed according to their superficial nature. Incurable disease will very often be palliated by mild medicine that act only superficially. Underline this. Okay, there is a thing regarding symptoms also. Sometimes symptoms are stronger, and when the symptoms are stronger, it shows a vitality. It shows that vitality is stronger. When the symptoms are not that stronger, that allergic rhinitis, okay, this is not a stronger symptom, rather it is an irritating symptom to the patient which is bothering him. But this allergic rhinitis, time and again patient is suffering this kind of cold, and this is not a very strong symptom, not a very strong symptom. Those high fever is a very strong symptom, and suppose the patient is taking time and again antibiotic. The moment one time will come where the patient will not be suffering from these kind of high fever again in his life. After say 4 or 5 years of taking antibiotics for his hyperpyrexia, patient is now not suffering from those kind of high fever, but rather certain kind of malaise, certain kind of distress, certain kind of bhal lagche na, like symptoms. Okay, means pain here and there. These are not strong symptoms because the vitality has been suppressed. The symptoms have been very much suppressed. This happens with the patients who are now, if you are going to suppress this also, this symptom, this external symptom like allergic rhinitis, if you are going to suppress this also, the symptoms will move interiorly. Okay, now be it homeopathy, be it allopathy, suppression is suppression. Okay, incurable disease will very often palliated by the mild medicine that acts only superficially, And more correctly, if it is not palliated, what is the difference between palliation and suppression? Suppression is the disease will go to a wrong direction, okay, and that symptoms will not return, rather the symptoms will shift its place. And palliation means the disease is palliated for the time being, and then time and again it is coming back. So this is palliation. So superficial medicines so those who are with knowledge of miasm will see in depth and prescribe medicines which is covering not only the symptoms but also the miasm. Same thing goes for the pathology. With the knowledge of pathology, we will prescribe the medicine which is covering both symptoms and pathology also. Okay, like that, a pain in the enlargement of liver. If you are giving, there are many medicines. Repertory is full of such medicine, pain in right hypochondrium. And if you are giving any medicine which have no role to play with the liver pathology, then the pain may be subsided for a time being, and then it will come again. Same thing you can say for the miasm also. Where you are not covering the miasm, the symptoms will time and again coming back. Will be coming back. Okay, then let me refer to an article I have written many years before. I think for the Australian journal, I have written an article for this similia. I have made one point there, which I will read it to you. That only going to symptoms will not do. Okay. Okay, family history and selection of medicine. There has been a tendency at times, there has been a tendency in our time to give more importance to mental symptoms along with the totality of symptoms, while completely ignoring Hahnemann's doctrine of chronic miasms. By doing so, we completely ignore the history of the development of the doctrine of miasms. By doing so, we completely ignore the history of the development of doctrine of miasms. It was the persistent failure of a well-selected remedy in chronic cases which led Hahnemann to look for some fundamental cause and to search his patient's past and family history. We need to consider miasms and their practical application using family history and patient symptom to access the true simillimum. Otherwise, we are bound to face the difficulties Hahnemann faced prior to 1816, when he started his depth evolutionary anthropological study of chronic diseases, which ended in his publication of chronic disease in 1828. Their beginning was, this was the line Hahnemann said, their beginning was promising, the continuation less favorable, the outcome hopeless. Okay, so if you are covering only the symptom, leaving the miasm alone, you won't get get the result. You are bound to find the same result which Hahnemann was finding. Okay, which Hahnemann was finding before 1816. Their beginning was promising, the continuation less favorable, the outcome hopeless. Okay, same thing can be said to the pathology also. If your medicine is not covering the pathology, okay, behind those secondary I'm not talking about those functional symptoms, characteristic symptoms, behind those secondary symptoms which are coming like a nausea and vomiting, or in loss of appetite or pain in left hypochondrium due to increased spleen, will not go merely with if you are covering the symptoms only. Rather, your medicine should cover the pathology of spleen. Same thing can be said to the pain in the right hypochondrium with the with pathology of liver. You have to prescribe some medicine which has the symptoms plus the pathology. So we can correlate here with the pathology, and we can consider here what is superficial, covering a medicine. When a medicine is superficial, when it is covering only the symptoms, okay, it is not covering the pathology, or it is not covering the miasms. Okay, if it is a secondary symptoms, you need to know that it should be from if it is due to some pathology inside, your medicine should cover that pathology also. Okay, ruta has a affection on rectum, okay, and any pathology of the ruta of the rectum, ruta can be think of because it has an affection on the rectum. Aesculus has an affection on the hemorrhoids. Okay, so you will see the symptoms are being produced there due to some pathology, and you are giving your medicine having both the symptoms and the pathology. You will be can be said to be well chosen. Okay, so, and I'm again saying that I'm not I'm not actually demeaning the importance of symptoms. The characteristic symptoms without any pathology, like whenever I go to toilet, there is a lacrimation there. So this patient may be prescribed upon this. There may not be any pathology, but this is very characteristics. Okay, so I'm not talking about characteristic symptoms. I'm talking about those secondary symptoms due to some pathology, or those symptoms again leave the pathology. If you are covering the symptoms and the miasm, you will see that will be also well chosen. Okay, act upon the sensorium, act upon the senses to the hidden and deep-seated trouble goes on the progress, and sometimes made worse, yet the patient is made comfortable, so that by the symptoms we can know whether the changes that are occurring are sufficient depth so that the patient may recover. The direction that symptoms are taking is sufficient to tell that, especially in chronic disease. Okay, from here the first observation will start, and we will discuss this in next classes. Okay, what is first observation? From here, page number 226. Okay, any question you are having, you may ask. If you are having any question, you may ask. Okay, no question, you can ask me the questions in the group after going through the lecture again. Okay, you can ping me personally or ask me in the group. If any doubt, any question is there, feel free to contact me. Thank you.